Many had thought that the prevalence of advanced HIV disease would decline significantly with the introduction of Treat All. However, studies have shown that about 20% to 30% of patients presenting for ART initiation have advanced HIV disease. There was a recent population HIV impact assessment conducted by PEPFAR between 2016 and 2018 that showed that about 11 to 22% of people living with HIV, but not yet on ART, have advanced HIV disease. And in addition, when we look at the challenge of retention in PEPFAR-supported countries, patients who disengage from HIV treatment often represent with advanced HIV disease. And also there's a large proportion of children and adolescents presenting to care with severe immunosuppression. It is therefore very important to bring more attention to advanced HIV disease to ensure that appropriate interventions are given in a timely manner to reduce early mortality.
The proportion of people starting ART in low and middle income countries with CD4 counts of less than 200 still remains significant, although it is falling with increasing treatment. It's as high as 30 to 40% in some countries. So among adults who self-reported as HIV negative status, but tested HIV positive in Lefia, for example, that is the Lesotho Population HIV Impact Assessment, 15.7% had a CD4 count of less than 200. And this varies between men and women. So it's quite important because although we have got quite a long way and we've scaled treatment, many patients still come to services when they are severely ill. And mortality among this population is very high, particularly in the first 3 to 6 months on treatment.
Most of these deaths are due to the two big killers, so TB and cryptococcal disease. And it's frustrating. It's 2017, so over 3 years ago that WHO released the guidance and emphasised the importance of us preventing advanced disease with a prevention package of TB prevention, cotrimoxazole and fluconazole. And there's some exciting new tools that we are starting to use, for example, to prevent TB that are less toxic and are more tolerable to be used. But unfortunately, although we see actually TB prevention being scaled up quite nicely and these new tools being introduced, cryptococcal prevention is really lagging behind. And likewise for treatment, some exciting new tools for cryptococcal disease, like flucytosine and liposomal amphotericin, but unfortunately they're not yet reaching the patients who need them. So this is quite frustrating. So I think it's really timely, having got those figures, new figures from UNAIDS, that we really kind of start to draw more attention to this unmet need.
The difference between wherever countries are in the 390s and reaching the 90s are a significant proportion of people living with HIV who are with advanced HIV disease. A lot of them, they've not accessed treatment. An advanced HIV disease defined by CD4 below 200, clinical stage 3 and 4, and children below 5, and of course, relationship to viral load, people who are not suppressed. So that huge chunk of people living with HIV who have not accessed treatment, are not suppressed, potentially people with advanced HIV disease. They form a critical mass in the entire epidemic control effort, and pose a significant burden to health systems, to communities, and that's why they are an important piece for national programs to focus on.